Raise your hand if you have ever assumed that you were already receiving all the government benefits you were entitled to, simply because nobody had told you otherwise. I made that assumption for years, and it was wrong in several specific and concrete ways that I want to describe today, because I suspect that if I was wrong, many of the women watching this are as well. I want to be clear before I begin that I am not a professional of any kind on this subject. I am not a lawyer, not a financial advisor, not a Medicare specialist, not a benefits counselor. I am a 72-year-old woman who spent the better part of a year paying closer attention to what I was and was not receiving, and who found, in the process of looking, that the list of programs available to women at this stage of life is considerably longer than I had understood. What I am going to describe today are 10 benefits that exist and that many seniors, including many women I know, have not been taking advantage of, either because they did not know the benefit existed or because they assumed without checking that they did not qualify. Every benefit I describe has specific eligibility requirements that vary by income, by state, and by individual circumstance. What I can do is name them and describe them well enough that you know what to look for. What I cannot do is tell you whether you specifically qualify, because I do not know your situation and because I am not the right person to make that determination. For each of these, the right next step is to verify your own eligibility through the appropriate official source, which I will mention as we go. Leave a comment below as we go if any of these turn out to be something you were already aware of or something you did not know existed. I find that this particular conversation is one where the comments tend to be very informative. The first benefit is the Medicare Annual Wellness Visit. If you are enrolled in Medicare Part B, you are entitled to a free annual wellness visit with your doctor, covered at no cost to you. Not a regular sick visit, a specific preventive visit designed to review your overall health, update your medical history, and put together a personalized prevention plan. Many Medicare beneficiaries do not know this visit exists and continue to use their regular office visit, which may come with a copay, when the annual wellness visit would have been free. I will tell you honestly that I did not know about this visit for the first 3 years I was on Medicare. Nobody told me at enrollment. I found out because I asked my doctor's office specifically what my Medicare covered, which I should have done much earlier. If you have not had an annual wellness visit with your doctor and you are on Medicare Part B, it is worth asking about it at your next appointment. The second benefit is the range of preventive screenings that Medicare covers at no cost. Mammograms, bone density tests, colorectal cancer screenings, certain cardiovascular screenings, depression screenings. These are fully covered preventive services under Medicare, which means no copay and no deductible when billed correctly as preventive care. The complication is that the same screening can sometimes be billed as diagnostic rather than preventive, depending on the circumstances, which can result in a cost. But the preventive versions of these screenings are covered, and if you have been avoiding them because of cost concerns, it is worth asking specifically about the preventive coverage before you decide not to go. The third benefit is Extra Help, also called the Low-Income Subsidy for Medicare Part D. This is a federal program that helps people with limited income and resources pay for Medicare prescription drug costs, premiums, deductibles, and copays. Eligibility is based on income and assets, and many people who would qualify have never applied because they assumed they would not qualify or because they did not know the program existed. The Social Security Administration handles applications, and the application can be done online, by phone, or at a local Social Security office. I want to say something about the income and asset thresholds on this program, because I think the assumption that a person earns or owns too much to qualify is often made without actually checking the numbers. The limits are higher than many people expect. The only way to know whether you qualify is to look at the current eligibility figures, which are updated annually, and compare them honestly to your own situation. The Social Security Administration website has a screening tool for exactly this purpose. Leave a comment if any of these first three were things you had not heard of before today. I find that the Medicare preventive coverage in particular is something that surprises a lot of people who have been on Medicare for years. If you enjoy this channel and want to support my work, just look directly below the video player, right next to the subscribe button, and click the button that says Join. That is how you become a Smart Organizer. Smart Organizers members get exclusive videos, a loyalty badge in the comments, and custom channel emojis. I would love to have you there. The fourth benefit is the Medicare Savings Programs. These are state programs administered through Medicaid that help people with limited income pay for Medicare costs, the Part B premium, the deductible, and co-payments. There are several different levels of assistance within this category, and they have different income thresholds. Many people who do not qualify for Medicaid itself do qualify for one of the Medicare Savings Programs because the income limits are somewhat higher. Your state health insurance assistance program, which is free and available in every state, can help you determine which programs you might qualify for. These programs are worth investigating before assuming you do not meet the criteria. The fifth benefit is SNAP, the Supplemental Nutrition Assistance Program. I know that many women of our generation have a complicated relationship with this program, and I want to address that directly. SNAP is a program for people of all ages with limited incomes, and a significant number of people over 60 who would qualify do not apply, often because they associate the program with a different kind of need or a different stage of life than their own. The eligibility rules for seniors include certain deductions from income that can make more people eligible than expect, and the benefit, while modest, can make a meaningful difference in a grocery budget. If income is a constraint in your life, this is a program worth looking into honestly rather than dismissing without checking. The sixth benefit is LIHEAP, the Low Income Home Energy Assistance Program. This is a federal program that provides financial assistance with home heating and cooling costs to eligible households. The amounts and the eligibility criteria vary by state, and the program is administered locally, which means the way to access it is through your local community action agency or your state's energy assistance office rather than through a federal website. If you have found that heating or cooling your home creates a financial strain in certain seasons, this program exists specifically for that situation and is worth looking into. The seventh benefit is senior property tax relief. Most states and many local governments have programs that reduce or freeze property taxes for residents who are over a certain age, often 65, and who meet certain income or residency requirements. These programs go by different names in different places: homestead exemptions, senior freezes, circuit breaker programs. What they have in common is that they are available, they can produce meaningful savings, and they require an application that many eligible people have never submitted. If you own your home and you have not looked into what property tax relief your state and local government offer for seniors, this is something worth researching through your local tax assessor's office or your county government's website. The eighth benefit is the Benefits Checkup Tool, which is available at benefitscheckup.org and is maintained by the National Council on Aging. It is not itself a government program, but it is a free screening tool that asks you a series of questions about your situation and identifies the federal, state, and local programs for which you may be eligible. I mention it here because it addresses one of the central problems with government benefits, which is that no single source will tell you everything you qualify for across all levels of government. The Benefits Checkup tool is specifically designed to close that gap, and I found it genuinely useful when I started paying attention to what was available. Tell me in the comments whether you have used something like this tool, or whether this kind of resource is something you were not aware of. I ask because I think the discovery of what is available is often more of a barrier than the application process itself. The ninth benefit is the PACE program, which stands for Program of All-Inclusive Care for the Elderly. This is a Medicare and Medicaid program for people who are 55 or older who need the kind of care that is typically provided in a nursing home and who want to remain living in their community rather than moving to a facility. PACE programs provide a full range of health and supportive services through a day center and can coordinate care in a way that makes independent living possible for people who would otherwise need a higher level of care. Not every area has a PACE program available, and eligibility requirements are specific. But for the right person in the right circumstance, this program represents an option that many families do not know exists when they are trying to navigate what comes next. The 10th benefit is the most basic and in some ways the most important: the Area Agency on Aging in your community. These are local agencies funded in part by federal and state governments that exist specifically to help older adults understand and access the services and benefits available to them. They offer counseling, referrals, and direct assistance navigating programs at every level. Every county in the United States has access to one, and contact information can be found through the Elder Care Locator, which is a service of the U.S. Administration on Aging and can be reached by phone or online. If you do not know where to start with any of the other 9 things I have described today, the Area Agency on Aging in your community is the right starting point because they know the specific programs available in your location and can help you determine which ones apply to your situation. What I want to close with is something simple. The government programs I have described today exist because legislators decided that the people who built this country deserve support in the stage of life we are in now. These are not charity. They are programs that were funded by the taxes paid by people exactly like us over decades of working life. There is nothing to be embarrassed about in looking into what you are entitled to, and there is nothing admirable about not claiming benefits you qualify for. The admirable thing is to find out what is there and to make use of it, because that is exactly what it was created for. If you are not yet subscribed to this channel, I would love to have you here. I post regularly on topics like this one, and the subscribe button is just below. Tell me in the comments which of these 10 benefits was the most surprising to you, or whether you found out about any of them and discovered you actually qualify. I read every comment, and I find that this is the kind of conversation where what other women share is often more useful than what I said in the video. And if this is your first time here, I would be glad to have you subscribe. I will see you in the next one.